in Ethiopia. We're using, obviously, stroke research, done in the West, thank God, but then at some point we need to know how stroke affects our people. In the US, Black American and white American, we treat hypertension slightly differently, right? There are some drugs that work better in blacks than in whites, and vice versa. This is done through research. We should be able to do the same thing for our society too. But how do we take this package, this full comprehensive package, to Ethiopia? Our progress, or what we have been able to, what we did to try to do this in Ethiopia, is published in this paper. But basically what we did was, how do we take it? Through a public hospital route? Do we take it through a public-private partnership route? Or do we take it through a private route? We didn't know at that point. So back in 2015-14, we started to discuss and communicate with our people in Ethiopia. We want to take it through the major academic hospital where I trained and became a doctor. And then that didn't work. After 2-3 years of back and forth, it did not happen. We could not get them to move and do things as much as we want. Then there was called public-private partnership, or PPP, where the government gives you land and building, and then you take the program, the equipment, yourself, the expertise, and so on. That did not work either. Even today, public-private partnership is in infancy in Ethiopia. So the only way for us to take a comprehensive stroke care to our people was through a private option. But then the plan has always been, from the private setup, we have to build, have to train, then move on to the public facilities. So first of all, we established a non-for-profit organization in the US. This is a 501c3 company in the United States. We thought, out of the 4 pillars of stroke care, maybe we can do 2 of them through this non-profit. This is to educate people and to fund research, to sponsor some grants of people in Ethiopia. Then we also established, let me see here. We established Axon Stroke and Spine Center, sorry. Which way am I going? Oh, back. Sorry about that. Anyway, we also established Axon Stroke and Spine Center through another investment company in the US. It's called Ethiopia Stroke Care PLC. And then we took that investment company in the US to a local hospital. We merged them together, and we created Axon Stroke and Spine Center. Now, this is the center where we train people, because somebody has to invest in the biplane suite, somebody has to invest in the devices, in the medications, in all kinds of things to be able to train people. So with these 2 organizations, one investment company, another one nonprofit, we assumed that we would be able to build a comprehensive stroke care in Ethiopia. So let's see how we have been able to do that. First is the care. Obviously the care, the hospital at the bottom was the first one that we started. Then after 2 years, we moved up to the hospital that's on top, where we established a comprehensive stroke services. Missing a slide here, kind of going back and forth. So in those 2 institutions, over the last 3 years since we've been in Ethiopia, we have been able to do quite a bit. Over 10,000 patients on follow-up, 1,500 neurointerventional procedures, about 500 per year. We have a lot of patient follow-ups. I was the first employee, and then we are now over 250 employees at this institution.